Over the past several days, both here in Ontario and elsewhere across Canada, the issue of how to best protect our hospitals has once again come up. As we've seen Quebec delay the implementation of their vaccine mandate for hospital workers, with BC softening theirs. Here in Ontario, many hospitals have implemented mandatory vaccine policies, as our government has maintained flexibility for health leaders to do so if appropriate. While some have called for province-wide mandate, any decision to do so needs to be weighed against the real risk of staff shortages that could compromise care. According to recent estimates, 15% of our health system workforce remains unvaccinated, putting the magnitude of potential staff losses in the tens of thousands. Let me be clear, every hospital worker should be vaccinated, and we encourage all of them to get vaccinated, and the vast majority have. But at a time when our doctors and nurses are already stretched to their limits, especially in northern and rural areas, we can't afford to lose qualified staff. At the same time, outbreaks in hospitals remain a rare occurrence. Recognizing the complexity of this issue, I've asked our top experts in the province for their feedback. This is an issue we need to get right, and we will.
I'm struck by your remarks saying 15% of the workforce remains unvaccinated, tens of thousands of workers. Your letter seems to be cataloging reasons why you feel that you cannot impose mandatory vaccines. Is this a foregone conclusion that it's going to be too difficult and you're too concerned with losing that many workers?
Not at all. I've always given the flexibility to the CEOs of the hospitals to make that choice. My point is, it's easy to go out there and say, fire everyone. That's an easy solution. People have to look at the ramifications down the road. Where are we going to be in 2 or 3 months when they're short tens of thousands of people? Nurses and docs are stretched and maxed out to the limit right now. And all I'm saying is, what are the ramifications in your hospital? We sent it out to every single CEO of every single hospital. And of course, Ontario is a massive area. It's different in the far north compared to southwestern Ontario and out east and downtown Toronto. But everyone has their challenges. And I can tell you one challenge, we're short healthcare workers. We're training as many as we can at record numbers. We're trying to get them back into the system as quickly as possible. But I go back to, how's this going to affect your backlog surgery? How's it going to affect the diagnosis? How are you going to affect when you go in for an MRI scan or a breast cancer scan? Is it going to continue to be delayed? What is their plan? Each hospital, I need to hear from them to find out what plan they have to make sure this doesn't happen.